So there is the second part of the task, and so let's do like this. So now you can see the slide full screen, right?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
So similar task, we have the beginnings and the endings of sentences. So just match them and change the verb in, use the verb in the correct tense in the second part of the sentence, please. Just 3 minutes for you. Well, let us check. So sentence number 5, Madhumita, please. Do you hear me? Hello, guys. Are you here?
Yes, ma'am.
Yes,
Yes, ma'am, you are audible.
Madhumita is not here.
Yes, and Madhumita is absent, as I see, right?
Yes, ma'am.
So Divya,
She
please.
was there at the first session, but now she's not.
Yes, I remember. So Divya, please.
Yes, ma'am. If I had a chance to do the whole thing again,
Mhm.
I I prepare for the consultation better. I
Uh,
will prepare for the consultation if better.
is it a real or hypothetical situation?
Hypothetical, ma'am.
Hypothetical. So
Hypothetical.
we use past in the if clause. If I had, and we use would in the main clause. So
Yes, ma'am.
I would prepare for the consultation better, right? Mhm.
Yes, ma'am.
Okay, so Priya, please.
Yes, ma'am. If you bring the child in on the 23rd November, ma'am, it is hypothetical, and the sentence, the correct will be, it would help stop him from bringing it up. Or, ma'am, it will be, we carry out the 6-week check.
Is it possible to bring the child to the doctor? So Yes, it's possible. And the present tense bring, if you bring the child, shows that this is a real situation. That is why this is the first conditional. And so what should be used? If you bring the child on the 23rd of November,
We will
we
carry
will
out
carry out
the 6th
We
week
will
check.
carry out the 6-week
Right.
check.
future simple. Okay, so Prerna, please.
Yes, ma'am. If you give him the solution in little sips, it will help him stop. It will help stop him from bringing it up.
So this is real condition,
Yes,
right?
ma'am. Because it's first condition.
Yes, first conditional structure. Okay.
Yes,
Nishat,
Yes,
please.
Yes, ma'am. If I had to talk to the mother again, I will certainly be a lot more sympathetic. Ma'am, this is hypothetical. Second
Yes.
conditional.
Yes. Second conditional. Good. So this is the way it works. Like the forms. We should remember the forms that we use in these two different conditional structures, and one of the home tasks will be connected with the use of first and second conditional structures. And so there is some information about so the screening. So the ages when checks are done on a child in the first 6 years in the United Kingdom. So a neonatal check is done by a doctor, performed within the first 28 hours of birth. The second is the 6-week check, also done by the doctor. It includes physical examination, health education, the developmental screening. In other words, gross motor development, fine motor development, vision, hearing and speech, and social behavior. So 6 weeks. And the next is the 8 or 18 months check. It is done by a health visitor, and it includes physical examination, health education, and developmental screening as number 2. And if we move to the next slide, there is information about this gross motor development screening. So which is at the 6-week check. So there is a head control. Head control, this is pulling the baby up, holding the hands from a lying position, and baby should keep head upright and not wobble. And Moro reflex up to 6 months. So support the head and shoulders about 15 centimeters from the examination couch, and suddenly allow the baby's head to drop back slightly. The response is extension of the arms followed by adduction towards the chest. Should be brisk and asymmetrical, and this reflex disappears by 6 months. And there is some more information. Ventral suspension after 10 months. Suspend the baby horizontally, face down. The head should be in line or slightly higher from the body, and the hips semi-extended, and prone position from birth. Place the baby face down on a flat surface, and the baby should be able to lift his head momentarily from the surface. And fine motor development and vision screening. So stairs follows horizontally to 90 degrees. So the baby follows something just that you show him. And so I would like you to look at this slide here. There are some phrases that we should analyze. So reassuring parents with young children and babies in order to relieve anxiety is a challenge. And we should decide whether these doctor's statements made to parents are reassuring or not reassuring, and give your reasons. So let us listen to Nishat. What about the first phrase here, the first statement?
Yes, ma'am. Fortunately, only a very small percentage of babies goes on to develop permanent damage. Let's hope Jane is not one of them. It's like reassuring, ma'am.
Reassuring. So
They are hoping to
Mhm.
do him well. Reassuring, ma'am. Reassuring to the parents.
So does everyone agree?
Yes, ma'am.
So fortunately, it sounds reassuring, but let's hope Jane is not one of them. Is not so reassuring. So the doctor says that there is a chance that the baby has some problem. So it's not very reassuring for me. And so let us listen to Prakriti for the next phrase, number 2.
Yes, ma'am. Rashes are very common and not every rashes lead to a meningitis. But it is a good that you are alert to this. Uh,
Is it reassuring or not?
yes, ma'am.
Reassuring, yes. And the doctor says it's good that you are alert to this. Just he says that this is a very natural behavior of a parent. Okay, now let us listen to Samhita. Number 3, please.
Yes, ma'am. If he were about 6.5 and couldn't say certain consonants like S, F, and he would probably have to look into it. Ma'am, it's not really reassuring because
Right.
they have said that we have, ma'am, because in the end it has written that we would probably have to look into it. So that can be a bit, that can cause nervousness to the parent. The parent can get nervous.
Look, which tense does the doctor use? I mean, in the if clause. The past tense, right? If he were about 6, and in the main clause, we would probably have to. So it shows that the situation is hypothetical, unreal.
Hypothetical, unreal.
That is why, so it's just the real condition is different, and so it is used to reassure, and it works in this situation. So the sentence is rather reassuring. Well, let us listen to Rafael, number 4.
Yes, ma'am. Many parents recently have brought their children in with exactly the same rash, but there is a viral rash going around. It's not reassuring, ma'am.
Why?
Because the doctor is saying that there is a viral rash going around. That it means that even the child can have a viral rash.
Okay.
So
yes.
it's not.
I see. Okay. So the next is for Ayman, please.
Yes, ma'am. It says, I can assure you, if there is a fracture of a femur from the delivery, it's nothing to worry about. I think it's reassuring, ma'am.
So if there is a fracture, and it's nothing to worry about, is the situation real or unreal or hypothetical?
Hypothetical.
Ma'am,
if it was hypothetical, we should say if there were a fracture.
if there were a fracture of femur from the delivery, it will be.
It would be. It would
It
be
would
nothing.
be nothing to worry about.
But here we have the first conditional structure. That is why the doctor shows that the danger is real. And I think this is this statement is not reassuring. So, And Arun Chalam, the next phrase, please.
Yes, ma'am. Epiglottis is very rare now, but we have had a few cases recently. Ma'am, it is reassuring because epiglottis there they mentioned it is very rare here, so that word helps. It is a bit reassuring.
Okay, yes, I understand that it's just not easy to say. I think that it's not reassuring because they say we have had a few cases. So it's possible that your child will get this disease. It's not reassuring. Well, and Madhumita, please, the last
Yes,
one.
ma'am. If we add a brain tumor, the rise in pressure in his head would be much slower. I think it's not reassuring, ma'am.
Is the situation real or hypothetical?
It is real, ma'am.
Look at the structure. If he had, so the
No, ma'am, it's hypothetical.
It's
hypothetical
hypothetical,
situation.
ma'am.
So, which is not our case, yes?
Yes, ma'am.
So the doctor says, if the situation were different from what we have now, so his head would be much slower. That is why using a hypothetical structure, the second conditional sounds more reassuring than the first conditional, for example. So, well, and so we should use the second conditional. And I would like you to have a look at the slide where the task is to make a list of possible statements you might use to reassure the patients in this situation. So the situation is Mr. and Mrs. Barton are anxious that their child, Robert, who has had several bouts of febrile convulsions, might develop epilepsy. And we should reassure so Mr. and Mrs. Barton that their 3-year-old child is not suffering from epilepsy and reassure them about the future. So please write some statements, some phrases that you would say to the parents of a 3-year-old child. So in this case, just 3 minutes for you to do this. Is the task clear?
Yes, ma'am.
Yes, ma'am.
Okay. Well, let us listen to the phrases that you are going to tell the child's parents. Divya, please.
Yes, ma'am.
What would you say in this situation?
Mr. and Mrs. Barton, that the 3-year-old child is suffering from epilepsy.
Divya? Hello, Divya. Are you here?
Yes, ma'am.
So you just you would like to you just suggest to say that the case is very serious and the child will probably develop epilepsy, right?
Yes, ma'am.
So well, and how to just reassure the parents? Maybe it's not the case. Maybe the situation is not very serious because the child just suffers from some febrile convulsions. So yes, I mean, what would you say?
Ma'am, basically epilepsy includes the symptoms like loss of bowel control and even breathing problems. So I can say that loss of bowel or loss of bladder control is very common, and not every breathing problem usually refers to epilepsy, but uh, Mrs. Mr. and Mrs. Barton, it's good that you're concerned and alert about these things. And ma'am, we can also say that many parents have recently brought their child with the same condition, like loss of bowel. But I think there is a viral going like about, ma'am, it can be diarrhea. We can say that it can be diarrhea.
Okay.
I
Yes.
I have
Yes.
written one sentence, ma'am.
Yes, please.
As a doctor, ma'am, I can say that if it were epilepsy, I would expect unusual behavior and loss of consciousness or awareness.
Yes, and it would, if it would have been an epilepsy, I would have expected staring and falling and like blackouts in children, like falling for no reason.
So,
Which is
ma'am,
not in this which does not
In this,
happen in this situation.
yes,
Yes,
ma'am.
please.
also in this case, ma'am, we can say that as a doctor, your child, Mr. and Mrs. Barton, your child does not have any unusual behavior, so I would not expect that it might be an epilepsy.
Okay, and anyway, in this situation, do we need any further tests and just research about the cause of these convulsions, bouts of febrile convulsions? Do we need to take some more tests? Yes, right? Just to know the reason of this condition. Okay, and
Yes, ma'am. They also
Ma'am,
like
mhm,
there is no loss of consciousness or awareness
mhm, mhm.
in that
Okay.
Also,
in
ma'am, they can
epilepsy.
also
If it were
say,
epilepsy.
Yes.
ma'am, we can also say that as a doctor, the epilepsy is not shown. Epilepsy symptoms are different from the febrile convulsions, as it is because of the bacteria, flu virus influenza, and that cannot lead to epilepsy. So we can reassure the parents that this is not epilepsy.
Okay. Okay. And so thank you. And if we move to the next slide, we can see 3 more cases of just the conditions with the child. And so we should also reassure the parents about the future. A mother or father or presents with a child, the first situation, the child who has pricked his finger on a dirty needle in the park, and the parent is anxious that the child might get So HIV or AIDS. So HIV stands for
Human immunodeficiency
Human
virus.
virus,
Oh,
yes. And AIDS,
Immunodeficiency virus.
Acquired immunodeficiency syndrome.
Immunodeficiency syndrome.
acquired
syndrome.
immunodeficiency syndrome.
Yes. So the child, the parent is afraid, is anxious about this. And the second situation, so parent presents with the child who is about to have a MMR vaccination. Do we remember the MMR stands for what?
Measles, mom.
Measles,
Mumps,
rubella.
Mumps, measles, and rubella.
Mumps, measles, and rubella.
Okay. And the third case, that a child who has swallowed a small silver coin. Well, please, who would like to speak about the first situation? What?
In first situation, we can say that it is not always usual that if a child or anyone prick his or her finger with a dirty needle, he or she might have HIV or AIDS. But to confirm this situation, we can follow up some tests.
Mm, 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 mm.
Ma'am, we can say that not every dirty needle might contain the virus for AIDS and HIV. So,
Exactly.
but to
Also, ma'am,
reassure you, we can proceed with some tests and procedures
Mhm,
so that
mhm, mhm.
ma'am, we can suggest first of all, we can suggest to get a tetanus injection to prevent infection, and we can reassure that AIDS virus can not survive for more than 42 days in a syringe that has been in a lab, and on with high temperature, it cannot survive more than 3 or 4 days. So we can go with the ELISA test just to reassure the parents.
Mhm, mhm. Okay. What about the
Tetanus,
second?
on the other hand, is
Yes, please.
tetanus, on the other hand, is important. We need to get vaccinated for the tetanus because
Mhm.
the needle was old. It can have rust as well.
Okay. So in the second situation about MMR vaccination, what will we say to to a parent?
We
Parent?
would say that it's an MMR vaccination which will help your child to get immunized
Mhm.
for these kind of
against measles,
viruses,
mumps, and rubella.
or so that in future the child might not get such attack of virus,
Mhm,
and it does not carry any side effects. So
mhm.
parents should
Okay.
not be worried.
Good. So, mhm. What about a silver coin? What would you say to a parent of such a child? Is it dangerous? Yes.
No, I think, but I think that if the coin is small, it will be of no issue. Like it can be removed out of the body through stools, so the child
Naturally.
can be so. Yes, naturally, since the coin is small and it won't be coming in the way of tubes in our body, and we can give him some medicines for bowels or something like that, so that it can easily can be removed out.
Mhm, mhm. Okay, good. So,
It can be dangerous as it can choke, ma'am, choke the children.
But it
Yes.
says it's small.
mhm, mhm. Okay, so good. Thank you. And so there is one more task, listening. And sharing experiences with colleagues to obtain feedback and advice is a necessary part of the learning process. And let us listen to a doctor training in pediatrics talking to a colleague about a child who had febrile convulsions, and let us answer the questions. So look through the questions, please, and now let us Start the listening.
Listening 3.
Can you hear?
Yes, ma'am.
Okay.
In the end, I felt I handled the situation better than at the beginning. At first, I got the child's name wrong. I was very nervous and unsure of myself, as I didn't have time to look at the notes made by the nurse or talk to her. This is just down to bad organisation. I felt the parents didn't like this, and it made them a bit edgy. But I recovered myself very quickly, and as I became more confident in what I was doing, the parents became relaxed, and the child became less agitated. I was very pleased, because they thanked me for being sensitive and being gentle with the child. I could see they appreciated the fact that I made an effort to make them feel comfortable. While overall everything went well, I learnt quite a lot from this experience. I should be more patient and prepare myself before talking to a patient. If I was short of time again, I would speak to the nurse first and get the basic details right. It is, in the end, all about teamwork and respecting the contribution of colleagues.
So, do we understand what the doctor was speaking about? Can we answer the questions? Okay. So let us listen to Prakriti.
Yes, ma'am. Was the doctor confident or nervous initially? Ma'am, doctor was nervous initially.
Yes, initially he was nervous. Okay, Samhita, please, the second question.
Was the doctor organized or disorganized? Initially, the doctor was disorganized as he didn't take the notes from the nurse.
Okay. So, Rafael?
Yes, ma'am. Was the doctor empathetic or insensitive at first? Ma'am, in the beginning, he was a bit insensitive, ma'am, but soon he became empathetic and sensitive.
Okay.
And made them.
Good. So, Ayman, please, the next sentence.
Yes, ma'am. Did the parents and child become less or more tense, ma'am, as the doctor became a little more confident, sensitive, and empathetic? The child and their parents become less agitated or tense, ma'am.
Good. Well, Arun Chalam, please.
Yes, ma'am. Did the doctor feel the consultation generally went well or badly? Ma'am, he felt it went well only, ma'am, because the parents were feeling less and he was a bit empathetic. So generally went well only.
Okay. So then, Madhumita.
Yes, ma'am. Did the doctor learn a little or a lot from the experience? He learned a lot from this experience, ma'am. As in the initially, he was very nervous, but as the time went, he was very empathetic and he was less nervous, ma'am. And he learned a lot from this experience.
And he learned to be prepared, yes, before meeting the patient.
He learned to be more patient and prepared before
Yes,
seeing a
ma'am.
patient.
Okay.
To be organized.
Yes, right. Okay. So Divya, please. Divya, hello. Okay. Priya.
Yes, ma'am. Would the doctor change anything in his approach or do the same again next time? Ma'am, he would change his things, ma'am. He has to be firstly ready for all the conditions.
Okay. So this is the way that shows that analyzing situations just help us to improve our behavior in everyday practice. So now, yes, we have a couple of minutes more, and I would like you to, yes, there is a home assignment for the next class, and it is also just about video. And this time the video will be about why I want to be a doctor. You should write a story. So your ideas about the reasons of your wish of being a doctor, you should just memorize them and then just take a video and just upload it to the YouTube channel. So, and your story should include the following information. You should answer the questions like what factors made you wish to become a doctor, like family tradition, personal beliefs, childhood dream, desire to help people, other factors. Is it easy to get a medical education? Where do you plan to work as a doctor, and what is the attitude of people towards doctors in your country? So this is the task. This is one of the tasks. And the second task is vocabulary task. No, grammar task, just about the first and second conditional structure. So I mean that I will, I'm going to upload it, the task to